The following portion of Daytime Blue Ridge is sponsored by
Well, whether it's your first puppy or your fourth, it's important to remember to vaccinate your puppy. Dr. Courtney Wiegard from Vinton Veterinary Hospital joins us now to tell us more. Welcome. Number four.
Number four.
Because you didn't have enough dogs.
Didn't have enough dogs. Had to add to the brood, to the pack, really.
Right, yeah. Yes. Who is this?
This is Money Penny. We call her Penny.
Oh my gosh, you are so cute. No wonder you wanted to take her.
I
How
mean,
old is she?
She's 9 weeks old. Boxer Great Dane, so little.
It's going to be a little dog, sure. Yeah, just to add to the pack. All right. Let's talk about vaccinating your puppy. When do we need to start the vaccine cycle?
So all puppies are born with circulating antibodies from their mom. Hopefully mom is up to date on her vaccine, so she will pass antibodies to the puppies during gestation.
Oh, okay.
So these antibodies need to be boosted as we go along. So really 6 to 7 weeks of age is when you should start. Most breeders will start for you, or shelters if there are puppies at shelters, but really getting into your veterinarian, getting started right away.
Okay, so maybe that's a question you want to ask before you even select a breeder, right? If they've done the
first puppy vaccine, correct.
Okay, and there are core and non-core vaccines. Tell me a little bit about the difference.
So core vaccines are what's recommended by the American Association of Animal Hospitals. These are the diseases that puppies are most likely to come into contact with and are the most important to vaccinate for. So canine distemper virus, parvovirus, adenovirus, rabies virus. So these are all considered core. Now, non-core vaccines are those that are recommended by the veterinarian based on the level of exposure that your puppy will have and what they consider to be core. So Bordetella vaccines, leptospirosis, parainfluenza, these are all diseases that you should have a conversation with your veterinarian.
Okay, and they can recommend which ones to have when. I mean,
correct.
Is there like way to group them together and get kind of a discount, because this can be expensive, right?
Absolutely. So a lot of these vaccines can be grouped into one vaccine itself. There's a 5-way vaccine, a 7-way vaccine that includes a lot of these together. But really, a lot of these veterinary practices now in hospitals will have puppy packages or wellness plans. So it's pretty easy for you. Go in, everything's laid out for you. You go through the protocol with your veterinarian, your veterinary hospital, based again on level of exposure, what kind of dog you have. Are they going to be active? Are you going to be hiking with your dog? Lyme vaccines. I mean, it's a good conversation to have, and every patient is individual, so it's not cut and dry.
And don't stop the series in the middle, right? You have to continue going.
Absolutely.
Because they're not completely vaccinated until what?
About 16 weeks of age is when all those maternal antibodies are gone. So really every 3 to 4 weeks until they reach 16 weeks of age, you should be getting regular booster vaccines and getting that first rabies vaccine, because that's by law, they need that rabies vaccine.
I was just going to ask you, are they required by law?
Absolutely.
The rabies is?
For rabies. But really what people I think forget is that they get 1 or 2 of the puppy vaccines and then they completely forget. And they're still susceptible to these very contagious and deadly diseases.
All right, Courtney, thank you so much. And if you want more information, you can always contact Vinton Veterinary Hospital. They have wonderful pet care, microchip services, and so much more. VintonVet.com, 540-627-5118.